The nationwide measles outbreak hit an alarming milestone as the number of cases hit a 25-year high. The CDC said 78 new cases were reported over the past week. Now, that brings this year's total to 704 in 22 states. Most are in New York State, where health officials have closed 7 schools. And they're also issuing fines to adults who refuse to vaccinate themselves or their children. Dr. Tara Narula shows us the expanding efforts to stop the spread of this deadly disease. Good morning.
Good morning, Nora. Measles is one of the most contagious diseases in the world, and the Centers for Disease Control and Prevention recommends everyone be protected. While no deaths have been reported in this year's outbreak in the U.S., at least 66 people have been hospitalized. With more than 700 cases of measles this year, the disease that public health officials once said had been eliminated from the U.S. now shows no sign of slowing down.
We certainly expect to see additional measles cases before these outbreaks are over.
Dr. Nancy Missonnier is with the CDC. The agency says the majority of people who have contracted measles are unvaccinated.
Unvaccinated Americans traveling internationally can be exposed to measles, and they can bring it back with them.
The CDC says 44 people caught measles this year while traveling in another country, some of whom triggered outbreaks here in the U.S. In New York City, more than 400 cases have been confirmed since October, mostly in Orthodox Jewish communities. City officials say some unvaccinated members of those communities contracted measles while traveling to Israel.
One must ask the obvious question: how on earth did this happen?
Local and state officials in New York are now pushing the legislature to repeal exemptions to vaccinations based on religious beliefs.
This will save lives.
Beyond legislation, some scientists say the future of prevention is using data to create disease forecasts that could warn people of potential threats. Dr. Sarah Del Valle is behind the project.
People could open an app every day and then see what kind of diseases are circulating in their communities. They can see the probability of infection. Hopefully that will help them take preventative measures.
Del Valle says we're still about a decade away from being able to accurately forecast diseases. The New York Alliance for Vaccine Rights, which opposes repealing religious exemptions for immunizations, says doing so violates long-standing rights of religious practices and bodily autonomy.
For those who don't know, what age should children be vaccinated?
So the first dose should come between 12 and 15 months, the second dose between 4 and 6 years old. The CDC just said for the summer, if you're going to be traveling abroad, even if you have an infant that's 6 to 11 months, you can get 1 dose at that point. And if they're over 12 months and you're going to be traveling, you can get 2 doses separated by about 28 days.
Do people need to be reminded how dangerous it is, like it can kill you?
Yes. And, you know, Secretary Azar said yesterday that this suffering is completely avoidable. Unfortunately, most of us haven't seen what can be severe consequences of the measles. 1 out of 4 hospitalized, 1 out of 20 with pneumonia, 1 out of 1,000 can develop encephalitis, which is swelling of the brain that can lead to permanent brain damage, and 1 or 2 out of 1,000 can die.
Is there anyone who legitimately shouldn't get the vaccine?
There are certain individuals, so if you're pregnant, for example, or if you have some immune weakened conditions, cancers or immunosuppressed, so there are certain individuals, or if you have severe life-threatening allergic reaction to the vaccine.
That's why we need this group and herd immunity.
Yes.
That's why this is so threatening, because there are a few people who can't get it. Dr.
Absolutely.
Tara Narula, always good to have you here. Thank you.
Thanks.